Evidence-based approach to public health practice. In this module, we will be examining the role of the public health professional on how to apply evidence-based public health practice. Evidence-based practice is an important process to use when making decisions in today's healthcare environment. The objectives for this module is to define evidence-based public health, the significance of evidence-based practice, and we will apply these concepts by reviewing a case study. Evidence-based practice is a process of lifelong problem-based learning. Evidence-based practice is a concept that applies to all of the health sciences, such as medicine, nursing, psychology, and social work. The process involves converting information needs into focused questions, efficiently tracking down the best evidence with which to answer the question, critically appraising the evidence for validity and clinical usefulness, applying the results in clinical practice, and evaluating performance of the evidence in clinical application. The practice of evidence-based public health is an integration of science-based interventions with community preferences for improving population health. Key elements of evidence-based public health include engaging the community in assessment and decision-making, using data and information systems systematically, making decisions on the basis of the best available peer-reviewed evidence, applying program planning frameworks, conducting sound evaluation, and disseminating what is learned. Implementation of evidence-based public health practice guidelines has been shown to improve public health practice and client outcomes, as well as reduce cost and standardized care. An evidence-based approach to public health could potentially have numerous direct and indirect benefits, including access to more and higher quality information on best practice, a higher likelihood of a successful prevention programs and policies, greater workforce productivity, and more efficient use of public and private resources. There is now an overwhelming amount of new information generated annually, monthly, and even weekly. Health professionals cannot be expected to keep current by reading everything that is published. Instead, the evidence-based practice process teaches professionals how to find the information that they need and when they need it. Evidence-based public health practice helps us answer questions to our public health practice, such as, how do we know we are doing the right thing? And especially in these difficult times, evidence-based practice helps us to make those tough decisions and gives us the confidence to make the right choice. Evidence-based public health practice looks at research and also takes into consideration the following questions, such as what has been done, how did it work, and how can I use that information to help my client or population? Brownson describes evidence as the available body of facts or information indicating whether a belief or proposition is true or valid. Brownson continues to state that evidence is limited for many public health interventions, yet approaches should be based on the best possible science, be multidisciplinary, and center on sound planning and evaluation methods. Here is a flowchart that displays the bringing together of the professional skills, knowledge, and instinct with knowledge of the client preferences, such as their values and beliefs, to determine the best evidence for us to make a professional decision. As a public health practitioner and other public health disciplines, you have the professional skills, knowledge, and that gut instinct to do what is best for the population that you work with on a daily basis. It is also important to consider the client preferences, because an intervention that may be acceptable in a more liberal environment may be rejected in a conservative environment. One example would be the practice of handing out condoms in a high school setting. There are many advantages to using evidence in your public health practice. Some of those include a higher likelihood of success when decisions are based on evidence rather than historical, political, or other pressures. By using evidence-based practice, common indicators can be identified and used to evaluate your own project. New knowledge can be generated existing programs can be supported and even expanded, and evidence can be used to advocate for new programs. In summary, the advantages of applying evidence-based public health practice results in more effective programming, better policies, improved decision-making, a better chance at funding, and also sustaining that funding and maintaining that program. This is an image from Satterfield that represents the domains that influences evidence-based decision-making. The top circle, which is the best available research evidence, represents the information that you find while conducting a literature review, or it's also your peer-reviewed literature. The bottom left circle, which is population characteristics, needs, values, and preferences, represents the values of the population. For example, an intervention that may have worked in an urban setting may not be appropriate for a rural setting. And the bottom right circle, resources, including practitioner expertise, and I refer to this as your gut instinct. Barriers to implementing evidence-based public health practice includes your political environment. An Institute of Medicine article described that decision-making in public health often is driven by crises, hot issues, or concerns for organized interest groups. I think we can all find examples of this when assessing the COVID-19 pandemic and how each public health department and state health department chose to respond to the pandemic. There are other barriers to implementing evidence-based public health, such as a lack of relevant and timely research. A lack of knowledge may cause you to make an uneducated decision. A deficit in information systems, resources, leadership, and competencies can all interfere with the successful implementation of evidence-based practice. Finally, here is the graphic from Bronson's models that displays the complete 7-stage process of evidence-based public health. If we notice, at number 1 is the community assessment. This is where you will gather information about your population. A community assessment may be targeted to a specific or general population. In addition to your community assessment, you want to identify the setting and the issue. Number 2 is quantifying the issue. 3 is to develop a concise statement of the issue, or here we will learn to ask that compelling question. Number 4, determining what is known through scientific literature, or this is finding the evidence, which includes searching the literature, appraising the evidence, and selecting that best evidence and link it with the clinician's expertise and the client's values and preferences. Number 5, developing and prioritizing program and policy options. Number 6, implement the program. And number 7, monitor the implementation of the program and evaluate the results. Now that we have learned about the 7 steps of evidence-based public health process, let's begin to apply what we have learned. The first step is to assess or identify the problem. We want to identify the problem by describing the population, issue, and the setting. Here is an example from a community that is trying to decrease sexually transmitted infections among the young adult population. I encourage you to pause this lesson and find the case study on the Nursing Experts Translating the Evidence website. References for this case study can also be found on the next public health website. This community has a problem with chlamydia and gonorrhea among the young adult population. Some of the assessment information that we know include chlamydia and gonorrhea are the leading causes of infertility in the United States. As many as 33 to 50% of women infected with chlamydia and gonorrhea experience pelvic inflammatory disease. This county includes urban, suburban, and rural residents with an estimated population of 180,620 residents. The county has an active health department with an STI program and a federally qualified health center with 4 different offices. This county has one of the highest rates of chlamydia in the U.S., and the majority of the cases are in youths and young adults. Even though gonorrhea morbidity rates are lower than those of chlamydia, they are still higher than the national county averages. After reviewing the population, issue, and setting of the county's STI problem, what outcome would you like to achieve? Well, there may be multiple outcomes. One may be to increase screening and treatment of STIs among the young adult population. Another outcome may be to increase education about safe sex practices. The question to reflect on is, from your current knowledge base, what steps might you suggest to reach that goal? An example may be that your community assessment and professional instincts suggest that teenagers and young adults are always on their cell phones. So perhaps you would recommend reaching your goal of increasing knowledge about safe sex practices by educating teens through texting and social media. One idea is that this county decided to form a community coalition to address this problem. And the first step of the committee is to decide to gather more data and to quantify the issue. The second step is to quantify the issue. In this community, the committee has collected the following preliminary data. Chlamydia and gonorrhea rates are highest among individuals between the ages of 15 and 29, which is consistent with the literature from the CDC. The incidence of both chlamydia and gonorrhea within the county continue to be 1.5 to 3 times than that of the state and national values. The rates of both STIs are greater among African American blacks compared to their white counterparts. Please review the case study for more statistical information about STI rates, knowledge, perceived risk, and behavior among youth and young adults. In the real-world situation, you may be faced with multiple issues with multiple sources of data. If this is the situation, then you need to pull out the most important pieces that are relevant for the problem. Step number 3 of the evidence-based public health process is to develop a concise statement of the issue. Step 3 is where you will clearly state your public health problem, and we will learn to do this in a PICO format. Thank you for listening to this module about evidence-based public health. I encourage you to continue on to the next module, which is about developing a question. A focused question will help you when it's time to search the literature. Thank you.